My first experience of racism in my role as a nurse, in fact, I was a HCA and I was working in an accident and emergency department. And while I was working, I was allocated to work in minors, which is like a less acute area, just doing small dressings. Then about 20 minutes before my shift was finishing, one of the staff nurses asked me to do an ECG on a patient. So I got a handover. This patient, I think he was like 80 years old, and he'd had chest pain, and the family said, the nurse who handed over said, he needs an ECG because they were short-staffed in that department. Would I come and do it? So I went in, I introduced myself to the patient, and he had his son and his daughter. Now, when I went in and introduced myself to him, I got permission, consent, and I started to put the probes on his chest. And then the son basically said, we don't want you to look after our dad. And I said, what do you mean? And then the daughter said, we want a white nurse. So I said, you can't actually choose what type of nurse, what ethnicity of nurse. I'm available and I've come round because they're short-staffed. Then he started calling me names. He was calling me, like, saying about my weight. And then his daughter interjected and they started shouting at me, telling me to get out of the cubicle. And then their poor dad was telling them, leave the nurse alone, let her get on with her job. So I was shaken up by this, so I left the cubicle and I reported it to the matron. And I said, they're telling me that I can't go into the patient, they won't let me do it. So the matron said, well, give them a white nurse. And they called the white nurse to take over from me, which they did. And then I was so upset by that because they didn't support me. But then it escalated because the matron said I could go home because I was so distraught. But then the next day, it was about 5 o'clock, I had a phone call from my employer saying, when you'd gone home, the patient's relatives had put a complaint in and they said that you had them up against the wall and you damaged her thumb, but we'd not come into any contact. And I was just really confused, thinking, how has that happened? But I thought, justice will prevail because I didn't come into any contact with the patient. There was witnesses, the cubicle was open, and also the father who was telling them, get out of the cubicle. I felt reassured. So then they invited me in for this fact-finding. So I remember sitting there telling them, this is what happens, and the matron knew. And I defended myself, and I had a union. And they basically sacked me for gross misconduct because they said that the patient's relative had said that I was very aggressive towards them. And so they sacked me, just like that. So what I had to do is I had to apply to go to tribunal. So to cut a long story short, I went to Croydon Tribunal where I won my case. The judge said that they had ambushed me, and they said that the judge said that because they didn't support me, it was completely wrong. However, it didn't end there, because what the family then went on to do, the family went to the local police station and they also reported me to the police. So the police had asked me to speak to them and give a statement, which I did, and I told the police exactly what I've just said to you now. And they said, okay, we're going to conduct our investigation. Then about 2 weeks later, or a bit longer, they said, there's no case to answer. So I thought, oh, thank God for that. I've won my case at tribunal, and the police have said there's no case. It was really traumatic, but I was so determined to then do my nursing. So when it happened, I was sort of in between becoming a nursing student and finishing my studies. But then when I applied to go to university, the university did a DBS check, and the DBS highlighted everything that had happened, but it was very biased, and it actually said that I'd hurt a patient's relative, and I wouldn't it said the patient's family had withdrawn consent. However, I continued to give care, but I got consent from the patient. So between the hospital and the police, they had narrated that situation and put it on my DBS. So therefore, when I was offered an unconditional...
About the importance of having a chaperone, I talked about the fact that sometimes a patient or their relatives could lie and lay false allegations against you as a healthcare provider. So you need to always be ready to defend yourself if such things happen. And people could lie really well. And the healthcare system and the judicial system is usually sometimes, primed to believing patients and relatives over the healthcare providers. That's the default. The default is to take the patient's word over the healthcare provider. So as a healthcare provider, it's now left for you to have enough evidence to defend yourself. If you ever find yourself in this kind of situation where this nurse found herself, where relatives didn't want her, because she's a black lady, or there's someone else, a white nurse to look after them, the first thing to do is don't even argue. Leave that scenario. Obviously, the patient was having chest pain, so it's a potentially life-threatening situation. He could be having a heart attack or something else that could lead to his demise. So you don't have to abandon the patient. Leave that situation. Not even try to advise and encourage that you have to do it. Leave that situation. Go and report to whoever is in charge, the consultant or the matron in charge. So it's now left for that person to provide an alternative staff or to handle that situation immediately. Then the next thing you should do is go into that patient's record and write a detailed narration of what exactly happened, because that narration you've written is going to help you in case the patient or their relative decide to, push the case further. Maybe they want some money, some financial compensation or something, for maybe some dubious reasons. They want to either tarnish your reputation or get some financial compensation. You have a detailed narration of what exactly transpired. So you go into the patient's record, you write that you offered to do the ECG. The daughter and the son said you shouldn't leave, that they wanted a white nurse or a nurse of any other ethnicity, and this is what you did. You left, you spoke to the matron or consultant who handles. So just go and write a very detailed narration, date and time, and write in the patient's record what exactly transpired, just in case maybe 6 months down the line, 1 year down the line, they decide to bring up a tribunal case against you. There'll be evidence, because by that time you may have forgotten the details, but now there'll be evidence that this is actually what happened. You have to protect yourself. Again,